All right, so welcome back to HIMSS 10. This is Better Health coverage here, and we're here with AeroScout with Gabby. So thank you for joining us here today.
Thanks for having us.
I read your press release here. You have a big announcement here at HIMSS. Can you tell us about that?
Yes, we have actually several announcements. Some of them are customer announcements. Some of them are product releases. One of the product releases we have, or may I say the solution release that we have, is around patient flow. And patient flow, is a hot item in healthcare and in hospitals. And most anyone who's visited hospitals has experienced lengthy wait times, unnecessary delays, just waiting for pieces of equipment, nurses searching for equipment, nurses searching for patients, waiting for other resources to come in. And what we have basically is a solution that solves all of this. Because what you may not know, or people may not know, that one of the main causes to some of these delays and unnecessary wait times is actually missing equipment and lack of visibility of high-value assets, whether it's patients, staff, medical equipment, and just the inability to have an effective and efficient and quick way to search and find these assets. So what we have done, we've basically revolutionized this by enabling to have a real-time location of these assets. And what we do is very simple. We attach
the camera right there.
Yep, there it is. We attach these tags to patients, to staff, to medical equipment. So whether it's a wheelchair, a gurney, an infusion pump, a defibrillator, a ventilator, whatever piece of equipment or high-value medical device that you're searching for, and basically we're tracking them. Look at it as an internal GPS system. So within the facility, whether it's one building, two buildings, several floors, we're tracking these assets, and nurses now, instead of searching for this equipment manually, they can go into the system, whether it's in their nurse's station, whether even it's on their tablet or a PC when they're on the go, and just search for these assets, and they can find them in real time.
Wow, that's fascinating. I'm a family doc myself, and we have a great audience of doctors and nurses there. I guess a question that pops into my mind is there concerns over interference with other types of equipment that may not pick up this device?
Yeah, so this is actually one of our sweet spots, because what we also did when we were developing this solution, we wanted to leverage existing networks. We didn't want to put in the overhead of an additional or another dedicated or designated network just for tracking these devices. So one of the things you see in hospitals today, in the U.S., more than 80% of the hospitals already have wireless networks. And they're using these wireless networks for all sorts of applications and devices, whether it's laptops or tablet PCs or PDAs or barcode scanners, stuff like that. And the age of mobility is here. So we're basically leveraging that Wi-Fi network, that wireless network that already exists in the hospital, and these tags basically talk to that network. So the network is already there. And just like you're using it for data and for voice applications these days, you can now also use it for location.
Oh, great. So I guess how does kind of the software solution work? Does it integrate to a hospital system? How does that work?
Yeah. So at the very basic level, the software solution enables you to search for assets, and you can view them on maps or in a list view, depending on which department you are and how you want to view it. But we also have a rules engine and a reporting engine which interface to other hospital systems. And this is a very interesting trend that we've been seeing, because as you go into these workflows and you're trying to improve these workflows and create new processes, because now they're no longer manual, they're automated, we've basically seen that there's just a wide range of applications that we can integrate to. Whether it's a nurse call system, so now when the nurse enters the room, you don't need to actually, the nurse doesn't need to manually go and click on the button and say that she's in the room. It automatically lights the light in the corridor, and the system automatically knows which nurse and the fact that the nurse is in the room. And if the attending nurse for that specific room is called and no one knows where she is, the system automatically detects where she is and sends a speaker alert to that room telling her. That's an example of nurse call. And we also had an announcement actually on Wednesday with the integration that we did with Roland Borg, the leading nurse call system provider, with our new Responder 5 system. That's one example. Another example would be infusion pumps. So it's one thing to find an infusion pump, which is what the basic functionality of our system gives the caregivers, but it's another thing to actually know what the status is. because you really want to know the utilization rate of the pump, not only where it is. So the fact that it's here enables me to find it when I need to do preventive maintenance or when I need a clean pump for a patient. But now I also want to know how much I'm utilizing the pump, whether it's 30%, 40%. How much time does it take me to get a pump from a status that it's now been used and until it gets into a clean room and it's clean. And by integrating into those systems, those infusion pump management servers, we're able to retrieve those statuses of the pumps and basically now make the search more context aware. So I'm not just looking for a pump, I'm looking for a pump that's actually available, clean, and not connected to a patient.
Wow, that's great. As far as where this information would be going, would it be able to be localized to more than one place, like a nursing unit or down in the security area? What kind of solutions do you have for that?
Sure. The solution is web-based, so you can basically run it off any PC, any workstation, laptop, PDA, even voice over IP phones. We have an application running on the Cisco voice over IP phones, which many hospitals are now using as their handset that they're using when they're on the go. So you can actually access this system anywhere in the hospital, and that's the nice thing about it. It's using, again, that same wireless network, the same Wi-Fi network those devices are basically using. And you can also now track those devices. So I can actually track where the laptop is because it's a Wi-Fi device.
Wow, you can't put those on doctors, can you, as far as trying to locate them?
But we find actually, so for example, when we put them on doctors and nurses or anesthesiologists in the OR, when you really need to do that tight management of location of resources to know whether a patient is now in pre-op and now moving from pre-op to the surgery room and then to PACU and knowing where the anesthesiologist is and knowing where all the staff is, that you have all the staff on time before a procedure starts, that's where you get into more tight, I'd say, workflow management and patient flow. So it really depends on the department, really depends on the processes you're trying to improve. But the key thing is that this solution is hospital-wide because the wireless network is hospital-wide. So by just connecting, again, these tags to the assets, you're basically lighting up all your assets, and it's actually quite cool. You have 2,000, 3,000 infusion pumps, which I have to say it's the hottest item we're tracking. I think hospital, let's say a 350, 400 bed hospital would track anywhere between 2,000 probably to 4,000 assets. I'd say probably half of those, can be infusion pumps.
Mm-hmm. And do you have the ability to track things like across campuses? Like if a hospital had to mobilize something from another site, how would that work?
Sure. So we have the ability to track across campuses. First of all, from an application standpoint, it can be multi-campus, multi-facility. So you have one application, one central database that manages all those. You'll be able to see when an asset leaves your facility and enters another facility. In other places, actually, they want to track the assets in the parking areas, in the outdoor areas. It's another interesting thing we do, so we're able to track assets outdoors. For example, we have a deployment in a VA hospital, and in the VAs, wheelchairs are a big problem, apparently. And they want to know actually where the wheelchairs are outside the hospital building and in the parking areas and all throughout the campus. So they're tracking that also with these tags outdoors.
Great. And another question that just popped up is that anything with mobile devices, I have a question on battery life and that type of thing. What about for this device?
Yeah. So this device has a battery. It's and it lasts up to 4 years. And there's a lot of, I'd say, technology and thought that has been put here in the development of these tags in order to enable them to get to that type of battery life.